So one of the questions that really come up a lot is, when should an employee start thinking about Medicare? And then what kind of things should they be thinking about? Hi, I'm Bethany.
I'm Lindsay.
We're here to talk to you today about some things about our favorite topic of Medicare. So one of the things that come off the top of my mind in terms of when, anytime within a year of coming up to Medicare entitlement, turning 65 within that year, I think is a good time to really start thinking about it. You can't enroll into Medicare Part A and B until 3 months before your 65th birthday. But what you can do prior to that is get started with it in terms of looking at Medicare plans, determining whether or not you want to take Medicare, because you do have that option if you're currently working. If you're covered on your employer group healthcare plan and they have over 100 employees, you don't have to take Medicare Part B. But keeping in mind, Medicare could be a really competitive option when you're thinking about Medicare.
Yeah, absolutely. I mean, that is something that we see come up a lot as far as, people just start having questions because they get mailers. They're getting, inundated with Medicare information from agents that want their business. But a lot of times they've got employer coverage and think, oh, you know what? I don't even need to worry about that because I'm already covered. When in reality, it might make sense to go to Medicare. I mean, there could be really good options with Medicare coverage that they just don't even know about.
That's one of the things we want to talk about today. So as we're kind of discussing, what are some things that someone should think about whenever it comes to Medicare? And one of the big things for me is it can be really scary. There's a lot of information out there, but not all of it makes sense. So number one, I would say, is educate yourself. There are so many different options available to a Medicare beneficiary that if you really get in and learn about it, it's not quite as scary. I know we've talked as well. Medicare was not something that we ever thought we would do, and obviously we love it. So really educate yourself and don't count it out. Don't think, oh, I have employer coverage, I don't need Medicare. Look at it as, I have employer coverage, but I have another option, which is Medicare. And that can really broaden your options and what it comes down to in terms of, how you're looking at it. Medicare tends to have broader networks whenever it comes to the provider directories. The other thing that I always like to kind of point out with Medicare is that, whenever someone's looking at it, I think whenever they're on an employer plan, you typically have one carrier and maybe a couple different plan options. With Medicare, what you have is several carriers. Within that realm, you also have many different plan options.
You can also build it around your provider network.
Absolutely. It can be definitely more customizable, if you will. Plans go by zip code, which is great because it can vary zip code to zip code, but that also means that you can have lots of different plans. So for example, we're around the St. Louis area. There could be up to 50 Medicare Advantage plans in someone's zip code. That could also mean 40 to 50 prescription drug plans. There's also Medigap supplement plans. And as we're talking about this, if those things seem foreign to you, that's one of the things that we're trying to emphasize here is educate. Once you kind of narrow down and understand how plans work, you can find the plan that works better for you in your situation, which is unlike an employer plan. One of the other things is Medicare premiums typically are more stable. For the most part, over the last few years, they've held out within, they don't typically go up too much. It all is determined on cost of living adjustments and things like that as to how much that Part B premium can raise. But overall, once you get past the Part B premium, Medicare Advantage plans, a lot of times, most areas you pay nothing to have those plans.
Absolutely.
Part D drug plans, a lot of times they have really low premiums.
I think the lowest I've seen recently was $2.50 for premium.
Yeah, so definitely great options there. There's also this Medigap supplement option that, is a different way to use your coverage. So you might pay a higher premium, but maybe you pay less out of pocket. So there's all different things to really think about and consider.
And speaking where also benefits coordination comes in.
That's absolutely right. It definitely helps. One of the things that you could do is get an expert involved. There's a lot of different places that you can go for help. Here at Allsup, we have the Allsup Benefits Coordination Service that is a consultation. But there's also, you can call Medicare themselves, the plans. There's lots of different things that you can do that don't necessarily cost money either. And just researching, obviously there's lots of information on the internet. One of the other big things I think to touch base on are out-of-pocket cost. Medicare Advantage plans tend to have really low out-of-pocket cost in terms of set copays for the services that you use as you go through it.
And protected with the max out-of-pocket limits too. So.
Yeah, absolutely. And they typically have low deductibles. So for example, in 2024, the standard Part B premium is $174.70. And then you get a plan in addition to that. But like we were saying, you can have $0 Medicare Advantage plans. The other thing is the deductible. So Part B deductible in 2024 is $240. Most of the time, whenever you get like a Medicare Advantage plan, you're replacing that deductible cost with the cost of the deductible of the plan that you're enrolling in. So what's great about that is many times we see $0 deductible health plan, health plan options. Sometimes there's drug deductibles built into that. Sometimes they're only apply to the higher tier medications. So again, it's similar in terms of health insurance and what you're used to in terms of employer group health plans. But overall, Medicare can really be competitive. So I think our biggest takeaway here is really to just take a look at it. Don't just assume that it's Medicare, so it's difficult and it's not for you.
That's something that I hear a lot too is, oh, it's Medicare, I'm working, I don't need that coverage, or it can possibly be as good as my employer coverage, when in actuality, a lot of times we find it's just as good, if not better, and it could end up costing less.
Yep. And every plan is different in terms of how their medications are covered and things like that. And again, going back to employer plans, you typically have one carrier and you have the copays and coinsurance as you use that plan. So if your medication with that carrier is not covered, you're kind of out of options. You're paying out of pocket. With Medicare, you could, you put in your drugs and you can find a plan that maybe covers it or covers it at the lowest cost to you. So all of those are reasons that definitely take a minute to look at Medicare as an option if you're coming up to Medicare entitlement. Even if you have already turned 65 and you're still working on your employer coverage, you can get off Medicare with most employer plans throughout the year. Definitely at open enrollment's a great time to look at it, but don't count it out.